Syokimau, yes. This so-called East African Portland cementing. Fellow Kenyans, members of the Fourth Estate. A few days ago, the Kenya Kwanza government announced the withdrawal of the services of the Cuban doctors from our health facilities. I, as former Minister for Medical Services, and now Governor of Kisumu County, want to make it very clear to the Kenyan government and the people of Kenya that a sudden withdrawal, underlined sudden, of Cuban doctors from our medical services is an irrational decision bound to plunge the whole nation into a terrible health crisis. Health is a devolved function. Counties provide such services as health where the rubber touches the ground. It would have been both constitutionally correct and sensible to consult with county governments before such a decision is made. At the Jaramogi Oginga Odinga Teaching and Referral Hospital, for example, we have 3 Cuban doctors, an oncologist, a dermatologist, and a cardiologist. Where are we going to find replacements for these doctors? You know for certain that these are very scarce in our medical system at the moment. What will happen to our people with cancer cases, for example, when the Cuban doctors leave without replacements? And we know for certain that cancer is in the increase everywhere in Kenya because lifestyle changes, pressure in life, and so on. The rational and wise decision should have been made was first and foremost to identify Kenyan doctors who can replace the Cubans before they are withdrawn. And if there are no Kenyan doctors, to explain to Kenyans as a government, the Kenya Kwanza government, where they are going to get such doctors once the Cubans go. I know that people in government who make these decisions can afford to be treated abroad. Ordinary Kenyans, unfortunately, cannot. May I plead with the Kenya Kwanza government to rescind this decision immediately. With the council, discuss with the Council of Governors what needs to be done regarding the Cuban doctors and their replacements without being in a hurry to score political bonga points. Thank you very much. Any questions or comments or additions? Okay, if that's okay, I just want to make a statement or two about the demolition of houses at Syokimau. Again, whatever the courts say, when the government immediately implements the decision of a court without giving the resident the right of appeal, a space of time to appeal such decisions, it is unlawful, unconstitutional, and inhumane. Secondly, even if the court made that decision, the people living in these houses should have been given time to find alternative accommodation. And secondly, the same government should have considered the value of those homes and decided what to do. The same government is building affordable houses. Why can't they build affordable houses to these people so that they don't lose their property, which they had earned? I've just read in the papers there's a lady who spent 18 million shillings building a house in that place. She has a bank loan. She has children in university and in schools. And suddenly, you withdraw one of her basic needs, which is quite clearly stated in Article 43 of our Constitution. Again, here is a situation where the government has acted unconstitutionally, inhumane, and unfair to ordinary Kenyans. They can afford in their places to demolish any house they have anyway, because they have access to all kinds of monies to build all kinds of homes all over the Republic. The ordinary Kenyans cannot do that. Thank you very much.
Questions? If I take you back to the Cuban doctors, if this decision is not rescinded, maybe as a government for Kisumu, what is your next course of action?
I'm telling you, it's going to land us in crisis. Because I know how long it takes to train an oncologist. And the only course of action is to access them from somewhere else. And that needs the central government. I was in Cuba with President Uhuru Kenyatta. When we went there to discuss these Cuban doctors, as Minister for Medical Services, I had been to Cuba before. And I recommended the Kenyan government that we should learn from Cuba. First of all, the training of family doctors. This perhaps is what led to our emphasis on community health workers and other things which I don't want to go into now. But obviously, if about a couple of years ago, 6 or so, we noticed that we needed Kenyan doctors. If we have not trained our people up to now, it is a mistake. So you don't suddenly withdraw when you have no alternative. It doesn't look good policy making or implementation either. So.
James?
Something rather off. During the devolution conference, the president promised to devote some functions to the counties. He said that it would take 60 days to do so. Has it been done?
No, it has not been done. In fact, we are meeting as a council of governors on Monday. I think today is what?
Today is Tuesday.
Yeah.
Tuesday 17th.
And then we're going for a retreat. Maybe a meeting earlier, not sure. But anyway, I talked to the chief executive of the Council of Governors, Mary Mwiti, and she told me that we have to meet very soon as a COG, either directly or by Zoom, to talk about some of these issues. Yeah.
Yes, please.
My question is concerning the TB drugs. Lately, there has been either shortage or limited supply of TB drugs, and there are patients who are raising concern that they could develop resistance. I don't know if you're aware of this.
No, I've not been aware by the Department of Health. But you can find an answer from Dr. Ganda or Mr. Juang Lucy, who is the chief officer. Dr. Ganda is the minister or the CECM in charge of health. Any other question? Hakuna? Asanteni sana and Mungu awabariki. Awachi nukududu. Undigo nogono. Ingeka karombo yuakiga. Kone no kika onyawarigili yang. Nikamlus ne itero chotwa kany. Jennifer Bondo ne itero chotwa kany. Ingeni kidhi wacho gima duong to nyaka igwe mondo. Sigweya. Abe kora gweyo. Nikamlus ne itero chotwa kany. Jennifer Bondo ne itero chotwa kany. Itero jokuba doctors kanye bwana. To ndewa kilo gika ni mondo gikonywa. Nikech waonge jogo motiegre maber e yore moko mar thiedho ji. Kaka joma nigi kansa, gidwaro ng'at moro ni an oncologist. Oncologist akia nang'o gi dholuo. Here is the Dr. Rai. Dr. Rai is the chief executive of Jaramogi Oginga Odinga, and he can tell you. Secondly, mar ariyo, kane wang'eyo kaka sirikal, an nakia, awacho ni wang'eyo kaka sirikal nikech wan sirikal manie county, wan omiwa tich mar rito ngima dhano. Sirikal maduong' mar Kenya omi tich mar tiego joma biro rito ngima dhano. Gitiegogi to gimiwagi. To ne wasewinjre maber ahinya ni laktache moa Cuba biro ka nikech onge migepe moko mag thiedho ji mapok wayudo jomotiegre manyalo timo. To koro sani tigologi kapok onyiswa kaka counties. Sirikal nogono pok onyiswa to kogidhi to ng'ano biro makawo kargi. To mar adek, be wasetiego jomoko Kenya ka manyalo kawo gik magitimogi. Dr. Anyang biro nyisi very well ni pok watiegogi moromo. Kech achiel no en ema en gi tich mar tiego joma tiyo e migawo mar ngima, rito ngima dhano. Ama wacho kama, gima sirikal otimo, otime without mipango maber. Dine gidwa time maber, to gibet kodwa piny, to waloso, to wacho ni kapok jogi odhi, wadwar jomo biro kawo kuonde magitiye, gitimo. Na loso kata gi joma nie ginene, migawo mar ngima, Nairobi, kawuono gi simu. To nyisa ni gin be gisetemo ahinya mondo gikel parono e sirikal. Pok ginyiso jopiny, to giwacho ni gisetemo. Mano kindgi kucha an akia. Koro gikotwa kama tek kabisa. Dr. Aino monde wada gokinyi. Ni en gi laini maduong' joma dwa ni oyud gine thieth mar kansa. En gi laini maduong' joma nigi yore moko matek yudogo. Mag adundo. Ting'eni tinde ji pethaga e Kenya ka joma nigi tuoche mag adundo ng'eny, kata un go gi tuoche mag adundo, kia ng'ama go. Uwinjo. Emomiyo nyaka wanyis jo Kenya maber. Nyaka wanyis sirikal maber. Gima negitimo ne rach. Onge mpango, onge paro maber, kendo chalo gima janeke motimo. Ok inyal bukri ka ng'ama dwa gwinene uso rombo. Tikawo rombo tidhigo, kata rombe wetegi pok inyiso. Nyaka giywageni. Ikamlus ne, itero chotwa kanyo. Jennifer Bondo ne, itero chotwa kanyo. Itero jo Cuba kure. To njo gikonyowa. Erokamano. Sawa sawa. Check I'm with my phone. No, okay. Okaromo ya. Erokamano. Kuro lande uru.